Hello, and welcome everyone to our newest episode of the Chief Healthcare Officer podcast. I'm your host, Dr. Fatih Mehmet Gül, and today's episode is titled as Pioneering Innovation, Leadership in the Future of Healthcare. We have a very special guest with us today, Professor Sultan Haider, the founder and the leader behind over 285 innovation think tank locations worldwide. Professor Haider is a true healthcare innovator with more than 440 innovations and 150 patent families, plus leadership and professorship roles awarded by key opinion leaders in the healthcare space. Today, we will focus on merging innovation with leadership in healthcare. And Professor Haider will be sharing his wealth of knowledge and emerging trends, the challenges of implementing cutting-edge technology, and how to develop future leaders who drive transformation. Professor Haider, welcome to the show. It's a great pleasure having you here.
Many thanks, Dr. Gul, for the kind invitation and our association and friendship over the past years, where I had the privilege to learn from your vast experience and to set up our first innovation think tank in a hospital under your leadership in Dubai.
I really appreciate, and it was all your great approach and your project, and it was an honor to collaborate with you. Professor Haider, I'm excited to have you here, and as you mentioned, we have had the privilege of collaborating on setting up innovation think tank at the hospital where I led for years, and I was very happy with the outcomes of our think tank projects. I can't wait to dive deeper into your experiences and hear about your remarkable solutions you have seen around the globe. Why don't you start with a personal background first for our audiences and followers to know more about you?
Thank you very much again, Dr. Gul. This is an honor to be a part of this episode, and I hope to reflect my learnings from my dear colleagues and friends from all over the world. My background is electrical engineering, and I studied with Siemens Healthineers, joined its magnetic resonance group in Erlangen in Germany. And a couple of years later, I started a group which was focusing on mainly R&D topics for medical imaging. And the program led to more and more focus on product definition, space. And as a result of working together with a number of hospitals and universities worldwide, we could establish the program locations also in these universities, hospitals, and later also in the governmental institutions. So over years, we have been able to build a huge network of key opinion leaders, partnerships with institutions, working together with researchers and students from all over the world, especially in the area of medical imaging and diagnostic space. And over the past 5 years, I've been engaging with the governments where focus is, of course, national priorities and mainly topics related to population health management, policy development. So that's maybe a short background that I carry myself.
A short background of a long story, and then let's get started. I'm sure we have a very long discussion, and we have lots of things to cover here. So for the first part, I want to discuss with you the landscape of healthcare innovation. We will look at the global landscape, and because you have lots of global initiatives, and also in our discussions, you have mentioned healthcare is about 20 years behind other industries in terms of digitalization and advanced IT systems. Can you please elaborate on that gap? What do you think is causing it, and how do we start narrowing it?
Thank you, Dr. Gould. I think this is a very good question. And I would like to start with the paradigm shift that we are observing today, which leads to these problems. We observe changes in societal behaviors and expectations. As a result, the requirements are changing, including the pace of technology implementation. We have left our natural environments and have adopted unhealthy behaviors. We are staying out of our comfort zones, just fulfilling our minimum requirements. And it has led to significant decline in creativity, a lack of purpose, and a tendency to take things for granted. Losing the sense of community has made human beings less empathetic and low interest, constantly prioritizing short term gains over contributing to societies. Overload of information and high accessibility to technology has led to prioritizing mostly challenges within the acute complication space rather than addressing the root causes. And this creates scarcity of resources for development as well as adoption of the solutions. At the same time, we observe the total healthcare expenditures a struggle to handle the exponentially increasing cost. Now, the good news is that healthcare is one of the top national priorities.
You also highlighted, in our discussions, shifting social behaviors and the rise of non-communicable diseases and growing focus on preventive care and population health. As you just said that, most of the governments, they're having a focus on this one, and always in their documents, they're looking for solutions. So from your perspective, which emerging technologies do you think, like AI, AR, or robotics are already making the biggest impact? And in which regions globally have you seen the most rapid adoption on this?
Yeah, Dr. Gul, I am seeing that the non-communicable diseases such as cardiovascular diseases, cancer, chronic respiratory diseases, diabetes kill 41 million people each year. 86% of these premature deaths occur in low and mid-income countries. Now, we can't solve today's challenges like staff shortage in a linear manner. I'm perhaps quoting you when we met last time in Jeddah. And I see technologies like generative AI, LLMs, AR, robotics as enablers, which will give a huge boost to overcome today's challenges.
That's really fascinating. I'm sure, such things will definitely help us. But then we often talk about the tech, but you also point out the fundamental human factors inside. Our unhealthy behaviors, digital addictions, and losing a sense of community somehow. So, how do we balance implementing new innovations while still addressing these root causes then?
Yeah, what I tried to actually mention, Dr. Gul, here is that these root causes bring us into the complications. And most of the time, we are trying to address these complications, acute challenges. And once we even solve the challenge, we are trying to solve another challenge. And this leads us to stay into acute space rather than looking into the causes of the problems, the root causes of the problems that actually lead to these symptoms and complications. And a lot of research is done globally. I observe this. You have research programs globally addressing how can we optimize certain opportunity space in the acute care. And when it comes to root causes, there are, thanks to the change that is happening currently worldwide, there are these national initiatives which specifically address these root causes with setting up the national KPIs like life expectancy, quality of life, healthcare spending, premature death from major chronic survival rate, number of physicians per thousand population, access to care. And there is also a huge focus on how to bring innovation to masses.
Thank you, Professor. Today, we can see lots of innovation words everywhere. And you're leading this with the innovation think tank globally. You're meeting with many people. But innovation word itself, when we look at the global landscape, we need to also identify this one. And whenever I discuss with our colleagues in hospitals and other healthcare companies, when we say innovation, always people think about technological innovation. Is it only about technology? Are there any offline innovations that you think we may need to consider and then implement in the healthcare to, help our patients and then make things easier for them?
That's a very good question. Innovation, in my opinion, is all about addressing the challenges faced by people. Doesn't matter if they're patients, if they're healthcare professionals, and who can address this. We always think that technology is available, technology is just an enabler. We need to find out how and what works best for that scenario. And who can answer this? These are the same people who actually work with this. So there is a increasing trend which I observe, and it's a successful one, to build local capabilities to incorporate the voices of the key opinion leaders, patients, healthcare professionals to solve these problems.
As a leader, I have always one way of managing the hospitals. I always try to sit and then stay in touch with the frontliners because what I have found out, frontliners, they know the best. They know the problems, so they also have actually recommendation for the solutions. And when I meet with them, I mean, starting from the valley, waiting the main gate over there, they know the problems and they can immediately provide us some solutions. And we can just focus on this and we can innovate the way of patient access. And then we have to listen our patients. We can give them some solutions. Before we were having the feedback boxes, and now we have the QR codes to collect such things, and we can just go and then help our patients to make things better. So I think when it comes to the innovation, some of the people in our industry, they consider this word as a very heavy word, costly word to stay away. And I think we need to simplify the innovation and we need to push this forward, because if we look at the pandemic days, if we were not looking for the innovations, we were not able to implement telemedicine, we were not able to implement immediate solutions on MEP, ICU management, and the others. So then, how can we simplify innovation for the healthcare leaders today? Can you just give us a simple identification for this so then they can also start listing some of the innovation recommendations?
Yeah, absolutely. I think you gave very good examples, Dr. Gul, and I saw this also when we conducted this program in the hospital you were leading in Dubai. You took some of the key opinion leaders' challenges. We brought some students together. We brought some researchers together. We had also some of the employees coming together. It's very motivating, encouraging for them to solve a problem that they could identify themselves and something that they can implement also in a very short period of time. I think innovation is really about solving things, and it doesn't matter if could be a process, it could be a technology, if it could be a behavioral change. And I think this should not be taken as something for which you need to really bring a new organization in place. Yeah, innovation should be coming out of the stakeholders that benefit from such a change.
Thank you so much. And in order to also see this, I think we don't need to go always to the Google or to Elon Musk or, I mean, the kind of Microsoft solutions or the others. I think each one of us could be the innovator here. So we have to just look at the operations and we have to listen our people and we have to bring such solutions to the table. Then some of them later will be an innovation. And we all know this one. I mean, all these innovations and inventions, they're coming out of a need. And someone should identify the need and should bring the solution. So, from the healthcare, can you identify some of the good innovation projects you have seen which could be good for people to listen?
Yeah, definitely. Maybe I would like to first comment, Dr. Gul, here about how do you actually start these topics. Yeah? So I want to take example, that we did together with you, where you had the 49th hospital with the 36% occupancy rate. And if anyone is leading such an institution, the key focus areas are, and I still remember, patient experience, operational efficiency, workflow optimization. And this is true for lots of hospitals around the world. Yeah. And of course, there is a process, there are some mechanisms which are available online. People can read if they are having interest. We have all these things available on our white papers. And it all starts with purposeful living mindset. You need to start with some good intentions and a topic that you want to improve something. Yeah? And giving examples by own actions rather than to manage. And I feel in this example, what we learned, we had a program for 5 days where a group of participants, they came together, they worked on these different workflows. They went around, observed, did some clinical immersion in your hospital together with the experts there. And once they understand what is the purpose, and the purpose were these 3 different areas, and we do similar programs around the world where we take topics like aging population, where we take topics related to optimizing critical care workflow. You make people understand that there is a significant value addition of their work. And I have a very simple formula for this, which I say, well, if the purpose of any activity, the purpose of is bigger than the effort, there is no problem to even get the resources. So we could engage about 100 participants in your program, including as I say, employees of your institution, students, researchers from all over the world who took part in a hybrid format and tried to come up with these solutions. I think these examples for me are really something which are a benchmark. We have conducted close to 200 programs like this worldwide, capacity building programs. And I think this is a very good way to start an innovation mindset within the organization.
I appreciate. I think this is, we can also call it as innovative thinking, and we need our leaders, while focusing on the daily indicators, KPIs, XYZ, they have to also keep as one side for the innovative thinking. But innovative thinking also requires lots of stakeholder engagement, and we need the multi-stakeholder approach, because that's one thing we always, see in our hospitals. One nurse brings an amazing project. And I mean, we have been managing magnet hospitals under this transformational leadership. We expect each one of our great people to speak up and bring some solutions. But then, if this colleague nurse brings a solution, and if this solution is not supported by supply chain or IT or finance or the other allied health people, it will not work. So, how have you seen this multi-stakeholder approach improving the patient care or accelerating the adoption of these new solutions?
Yeah, also another very good question, because this is something which one needs to immerse the environment within such a project. So people need to feel that they are part of it. Yeah? So recently I was discussing about your podcast and with a colleague, and he mentioned to me about the topic of communication. Yeah? So I was asking many people, so thanks for giving this month's time. And I really took the opportunity to ask many friends around the world, how do you see this? And they were talking really about communication. So one of the key topics people said to me was really communication. You know, if you can engage people in transparent communication, talking about, well, this is what we want to do, and there is benefit out of the new technology, the new process that will be built, and you're a part of it. I think this motivates the individuals a lot, even making them the part of acquiring that project. So somehow they should feel that they are part of such an initiative. This is helping a lot. And in our this programs for capacity building, we try to create like a university-like atmosphere where people get to first of all know each other, then get to know the topic, get to know the state of art, which is also important because they should not feel that, oh, maybe something has been done in another part of the world. And I think this bringing people together, where technology helps us today, with you can invite speakers, you have a lot of speeches recorded online, which people can look at and say, oh, I know what's going on in US, I know what's going on in Europe, I know what's going on in Asia, Middle East. And I think this makes people more and more confident with new innovations.
Indeed, indeed. I mean, we keep having wonderful guests like you in our podcast show from Singapore, from Paris, from London, from LA, from Dubai. And when I look at the daily issues of the healthcare operations, patient experience, we're all discussing the same challenges, same thing. And at the end of the day, healthcare, I believe, is a people business, and we definitely can only manage and get the best outcome with the communication and with the multi-stakeholder approach. But there is one thing here. I mean, innovation in healthcare is not always smooth sailing, if I may say. There is a resistance to change, and regulatory complexities are there, and most of the time the budget constraints and so on. So in your experience, which obstacle tends to be the biggest roadblock, and how do we start overcoming it?
Another very good question. In my experience, the biggest challenge is having lack of purpose and awareness. Yeah, so if people are working on a topic, I visit lots of universities where I remember in Australia we were conducting a program, and after attending our 5 days event, or one of the participants who was at that time doing a postdoctoral studies research came to me and said, "Oh, I should have known what kind of topics I should choose in my life." Yeah. So this is something not very nice to hear. Yeah, you spend years of your life doing things which do not attach to a purpose that brings impact not only for society but also for you as an individual. So that's something one needs to avoid. And I think awareness, business and reimbursement models, skill sets, budgets and resource limitations. They're all the regulatory hurdles. But if we can address this topic of making the purpose clear, defining what value do we add as a result of doing this project, doing this change to the environment, to the different stakeholders. This is accelerating and not only adding, but accelerating the entire innovation process.
I love it. I love it. So the formula is impact must be greater than the effort. I think
Yes.
that's a wonderful approach. And I mean, last time when I have looked at your updates, you were in Canada and you were also meeting with different stakeholders. I have seen that you met with hospitals and then you met with the universities and some other industry people. And I mean, impact is fine. We will identify the impact. We will identify the effort. But again, it will come to the collaboration and then partnerships. So if we look at the effective partnership between the hospitals, universities, and private industry, then how are we going to have collaborative effort to have the right impact? Can you give us some examples? Because you keep traveling from Japan to Canada. We want to learn from you how we can integrate these external organizations together.
Yeah, maybe I would give an example. 5 years before I started to paint, and then I learned that you need to sketch something on a canvas, and then you start filling colors inside. So I think that that sketch is the intention. Yeah, you should have the right intention of what you want to do. Make it clear with the purpose. Make people aware of what you want to do. Even define that purpose together with them, and I think this is where like-minded people come together. Yeah, this is what I feel globally with our programs. So there has to be some value add of people working together as individuals. So I really believe in this, that if I cannot add value as an individual, then it might be difficult to engage myself as an organization with people. So the best partnerships I have worldwide are where I am participating, bringing my experience together, with the whatever institutions worldwide. And I think this kind of relationships are the strongest ones. Maybe this is maybe the formula that I want to share, that if you want to partner, don't partner just as an organization. Of course, this adds a lot of value, and there's a huge commitment, but the decision making is usually easier when people are adding value as individuals, because our programs, wherever we did together, these programs, we had an engagement with the university, with the hospital, where it was very clear that we are writing a paper together, we are writing a grant together, we are writing a book chapter together. It was small things, but it led to even some exchange of employees and students working in our labs, vice versa. These are big topics. Sometimes they become a part of a huge MOU, and then I wonder do we need to do first an MOU, or do you need to do first the contributions in a bidirectional way on some cause, which could be again an academic engagement, scientific engagement, and this leads to bigger partnerships.
I totally agree with you. I mean, I was in UK, and then a couple of our colleagues, they were working on having the private hospitals and clinics supporting to the NHS waiting list, and they're working together. And just like as you explained, they're focusing too much on the process rather than the impact, rather than the outcome. At the end of the day, I mean, it's all about helping patients to get services much faster than the regular. If you focus on this and if you outline this purpose, then it will be very easy for you to set up. And people are very smart. I mean, you just give them the purpose, they will start painting the sketches, as you said. But then, unfortunately, when we have such integration and then complex projects, most of the time we lose all the essence, and then we miss the opportunity while spending too much time on the process. Then the process makes things more complex and innovation doesn't work. So, Professor, now I want to shift to the future. And I mean, in your innovation think tanks, ITT projects, I can see that you meet with lots of young people, again, in Asia, in the Middle East, and America, in Europe, and then you're actually pushing to develop the next generation of healthcare leaders. And also, when we discuss with you in several occasions, you have spoken about the self-innovating infrastructures and then the importance of mentorship over there. Can you please tell us more? How can we create a self-innovating infrastructure, and what does it mean for the organizations?
I used to always think, why do people like Dr. Gul invite me to set up an innovation think tank in his great institution? Um, I was running these capacity building programs where we were teaching innovation entrepreneurship methodologies. And I was still wondering, I used to think that some people they started to say, maybe, because people like to work with you, they create such programs. So I again wondered till I observed that there is a need for addressing challenges within, so maybe the strategic, to address the strategic business targets of the institutions. So there is a limitation of resources. There is a lot of business done within the hospitals, within the universities, which is not coming from outside organizations, larger suppliers, but this is needing some local capabilities. And in order to make sure that these programs are not dying after we run them for a few months, for a few years, we needed to find a way to make them self-sustaining. And the way we do this is we apply for some grants together with the institutions, looking at the topics. Could be neurodegenerative diseases, where we apply for some public funding, where we get some PhD candidates positions sponsored. And I think this leads to also plus creating some lab infrastructure. And this leads to having some infrastructure, as well as another topic that I want to mention, that over time, this knowledge starts to tour within the organization, starts to build up. So we built these different disease pathways, product lifecycle models, and we share them also between these different institutions. So you can actually download these knowledge frameworks that we have developed over years from the website. And this is helping, let's say, a new institution who is now creating a program, an innovation program, innovation framework, not to start from scratch. So you can actually accelerate the innovation process. You get all the knowledge, and then you can build on top of what we have done, perhaps in different parts of the world. And this leads to creating an environment that's self-sustaining over time, innovative, as well as people have this feeling of ownership for something, and plus they can take advantage of our global infrastructure.
I agree. I mean, if I look at my organizations, at the end of the day, our people, they want to see consistency. They want to see accountability on such projects. Otherwise, switch on, switch off projects do not make people excited and do not have the actually benefit for our patients. But we need to, on the other hand, also support especially our young generations and then our young colleagues for them, because they are all techno savvy, and I love to hear their recommendations and then the projects. We need to add some empathy and then purpose in their, I mean, project thinking process. But definitely, I mean, they are the future, and we need to also push this. But then for them to think and then to bring more recommendations, we need to also create a safe space for growth and making mistakes, right? I mean, we need to create a
Absolutely.
just culture over there. So here the question, how do we find that balance between being responsible with patient care and still allowing staff and leaders to experiment and learn?
Yeah, I also tried to again ask many people in our offices and labs, what do they think about? And I would like to just read this part. Dr. Gul, I prepared this, so I have to say this here, if you allow me.
Sure, please.
Yeah. So there are these 6 pillars. I checked it with a number of colleagues, and they mentioned, because I wanted to know what do they see in these innovative environments. And what they said to me, and I was surprised to hear this, that they say the first point is like-minded people. Yeah, so these environments consist of like-minded people. I asked them, what do you mean? Don't you think we need to be diverse? And so these are two different things. So they have another pillar which is called multidisciplinarity and complementary skill sets. But still, like-mindedness means here people have the same intention. Yeah, they all want to grow. Another thing they said was being dependable. So they would like that they have the possibility, as you mentioned also, it's a safe, comfortable, and safe space for growth and trust. And healthcare is a space which already is a very responsible space. So people care a lot about the implications of what they are doing. But you need to still make sure that there is some space for creativity, there's a guidance and leadership, and that the tangible impact should be very clear. So these are the 6 points which were mentioned to me, and I feel that they somehow address the creative environment pillars for me.
I really love this approach. And I mean, I think we have covered enough. We have seen the global landscape, why we need the innovation, and how we can manage this. We have looked at the challenges, how we can cover the actually such culture in our organizations, and how we can introduce this. And we also have looked at the leadership part. And definitely, I believe also another point, maybe the seventh point I can add. Every person want to work in an innovative company rather than a company which only applies the things, the model of the operation, which is 40 years old and never changes. I think no one wants to work in such a company. And with such innovative approach, I believe we will be also attracting the best talent joining us. So, Professor Haider, I really appreciate all these insights. And as we approach the end of our discussion, I would love to hear from you on the next big breakthrough in the healthcare innovation, because you're traveling, you're meeting with people, you're seeing the factories and others, and we're all, I mean, trying to understand where the next innovation is. So, where do you see the biggest strides happening, and what might be the completely reshape for healthcare as we know it?
Yeah, that's like again giving a canvas to draw something. So I also had to think a lot on this question. And I think that the next breakthrough will and should enable healthcare for masses, by solving really the root causes that lead to the challenges for the healthcare systems. I think it's going to be a combination of various solutions, technologies like AI, robotics, especially new business models focusing on population health management and really democratizing value innovative solution.
Wow, that's going to be a big thing, and let's see how it will be implemented.
Yeah, and maybe one more point here. Topics like aging population, even nutrition, preventive care, multimodality, patient management needs holistic approaches. Of course, we continue advancement in science. However, the availability of technologies and willingness today to improve quality of life offers us a unique chance to build sustainable ecosystems and ventures.
Amazing. I mean, I was reading a book and it was saying that it's not just about only longevity, it is about having a long, healthy life. And then that's what we need lots of innovations, I guess, for that. So thank you so much, Professor Haida. This has been really a truly enlightening conversation for me, and I learned lots of things today from you. So before we close, could you share a couple key takeaways for the leaders and innovators tuning in? Perhaps one simple action they can start with tomorrow.
Yeah, thank you very much again, Dr. Gul, for the invitation. And I thank all the people I spoke to in the last month from all over the world for this preparation. I think I would just go through the 4 questions that you had. The first part where I think we need to work on the root causes. Yeah? So I think if we work on the root causes, we will actually have a bigger impact. Now, the second topic, you know, we need to have the clear intentions and a purposeful living mindset. In order to have impactful innovations, we need to make sure that we do not reinvent the wheel, make use of the knowledge assets, the frameworks that might be available around the world. They are available. We are in a really blessed era where AI is helping us in doing things faster than ever before. a disease-oriented approach, a patient-centric approach, key to the solving the problems both for patients as well as healthcare professionals, as well as for the stakeholders. I think working with governments, on healthcare policies, defining the right policies is something which I think is also something that helps in creating the right research programs to have the investments in place. And one point that you also mentioned, investing on the next generation of leaders. So leaders create leaders. I think that would be my final words. And really creating local capability development programs within the institutions for innovation, entrepreneurship, and commercialization. I think that can really boost creativity of the employees as well as the ecosystem.
I really appreciate. And I love this point. Leaders create leaders. That's definitely the level 5 leadership that we always ask from our people to focus on and look for the, best way how to make this happen. Thank you so much, Professor. We really enjoyed, and thank you for tuning into the Chief Healthcare Officer podcast. So we appreciate having Professor Sultan Haider today with us, and thanks to him sharing his invaluable insights on leadership and innovation in healthcare. This has been Dr. Fatih Mehmet Gül, and until next time, keep striving for innovation that truly benefits patients, providers, and communities alike. Thank you so much, Professor, again.
Thank you very much, Dr. Gul, for the kind invitation. It's always an honor to interact with you. Thank you very much. All the best.
Thank you so much.